Yum, everybody. Welcome back to another presentation in the Quality Improvement Program. I'm going to be host today. My name is Robbie, and what we're going to be going through today in this presentation is it's called the Integrated Team Care Program, also known as the ITC. We're just going to be breaking it down of what it is and how it benefits yourself, your practice, and also your First Nations clients. Also, I'm just going to be taking where this you see my face right now. I'll just take the screen off. You still hear my voice, but I just take the screen off because of just in case there's some information on there you need to see or doesn't interrupt or intrude any other dot points along the slide as we go. I'm going to sit down and have a couple now as I do this. Hopefully you got a beverage on your lunch break or whatever you're doing. Let's go through and then get it done. Just before we go any further, I would like to take this moment to do an acknowledgement, and I would like to recognize and celebrate the diversity of the First Nations cultures and acknowledge and pay my respect to the elders past, present, and emerging, as they are the traditional caretakers of the lands, the waterways, and seas that we all live and work on today. As today I'm doing this acknowledgement, I am tuning in from beautiful Awabakal country, and I also like to pay my respects to any First Nations participating on this webinar today. What we're going to be covering today in this presentation is just a breakdown of the understanding of what the Integrated Team Care Program is, who can benefit from it, who and where offers the program within your local area or district, and just the referral process into the ITC or the Integrated Team Care Program. Also, just a little side note is I'll just refer to the Integrated Team Care Program as the ITC program. It just helps with the whole flow of the information and how the wording is done around in the presentation. So what is the ITC program? Well, the ITC program, previously known as the Care Coordinator and Supplementary Service, or in the brackets and the first dot point, the CCSS. But just breaking that down, the program, it just supports Aboriginal and Torres Strait Islander people with complex chronic conditions. It often provides a one-on-one support to help people manage their conditions and get the health care that they need. It also helps with health services to provide culturally appropriate services. So when a 715 health assessment is done, then if there's a chronic condition that's identified in there, then you actually can refer into this program with your First Nations patient. And all these programs, the 715, and we've said in other presentations, the 715 is all part of the Closing the Gap, and so is this the ITC program. In this slide, we're just going to go through who can benefit from the program and also how they can benefit from the program. I'll probably give you a couple of examples that right now is just while you're reading those dot points on the screen. But just say for example, one of your clients live remotely or rurally. They're just having diabetes, and they're leaving how they manage their diabetes is they're leaving it to when they get administered into hospital. And all those complications that come with that, which is not good. So the care coordinating team can actually help with that. They can help with their booking their appointments, transport, and keeping that consistent so we don't get to that point of just waiting to go to the hospital to manage your diabetes. And just probably around another example, just one of your patients, is still living remotely or rurally, and probably doesn't have to be remotely or rurally, but any one of your patients that it just doesn't have that health literacy around their chronic health condition, just that understanding of what they have, and that in-depth look at it. The care coordinating team on the part of the ITC program can help with that, with all that health literacy. They can help with the whole journey of the pharmaceutical journey. So just with the tablets and how to manage that and how to wean off that. And also just with transport, like I've said that already, gap payments, all that stuff gets taken care of in the background, which can benefit the patient, because I know it says here in the slide is who can benefit from it. It's also how they can benefit as well. So most everyone who's training today understands or knows what a chronic health condition is or disease. I don't want to assume to have done that before, so I'll just read it out now. In the circles that are here on the screen, that's the diabetes, your mental health, your cancer, which covers your lung, bowels, and breast, cardiovascular disease, which is stroke, coronary, and heart disease, respiratory disease, asthma, and COPD, and your chronic renal disease. So these are the ones on your screen now that qualify your First Nations patients to be on the ITC program. So eligible. In this slide, just going to go over and touch base with a bit of the mental health that's going around with mob at the moment. On the right of the screen there, this was a report, a behaviour report that was done amongst mob around Australia from both sexes, male and female. It was conducted back in 2018, 2019. So the self-report survey responses were an estimated 24% of Indigenous Australians reported having or being diagnosed with a mental health or behavioural condition, with a larger high rate amongst females. They were at 25%, and males were at 23%. Now, more than 1 in 10 individuals reported having diagnosed anxiety or depression. Anxiety was at 16.5% and depression was at 13.5%. 2/3 of Indigenous adults reported a low to moderate level of psychology distress. The rate was higher amongst males. Males are at 70% and the females are at 63%. So I guess poor mental health, it affects a lot of parts of our lives. The whole, I guess, the stress around incarceration, removal of families, you experiencing racism, the whole unemployment, loss of life, around sorry business and stress of everyday living. We all in this call today, we all know that stress affects the whole chain of our health. But when it's at these levels, it and it's just constant every day, it does contribute to a lot of our chronic health conditions. And there are a number of available services for mental health, for your First Nations clients. If you seek support through the ITC program, they will actually guide you to the appropriate services that are culturally safe. And just flowing on from the last slide to this one, this is some more analytics around this research and study that's been done on communities around Australia with how these chronic diseases affect us and our lifespan. And I'm not going to sit here and read it all because the numbers are pretty dim. But our life expectancy isn't great compared to the rest of Australia. The health quality that we get, that all comes in a lot of different factors too. But with not only access, but just for where we live, health literacy, like I've said before. And I'm not going to sit here and read all these numbers out, but the more we can refer into this program for your patients, it's just giving them a bit of a front foot and how to manage that. That's what it's all about, learning what they have, how to manage it, so that then it's just less a strain for themselves and for the health system. And then, yes, they get better care, but they also get that understanding later down the track where they can be a contributor or I guess a voice in their community in how to manage something or be an advocate or get that early intervention. Just flowing on now from the last slide to this one, there's a few more analytics that are in this slide that's in front of you. And, don't want to bore you too much with any more of the whole data, but, there's some big numbers there. And, a lot of it can come down to contributing factors, social, emotional, economic disadvantage, housing, education, employment. But in the day, without reading this all out and going into too much of that terminology of that's negative, but the more we can get our mob onto this program, the more we can get them on the front foot and letting them take accountability and be educated in their own complex chronic disease, and understanding that is a big thing for them. They take that control, and that's one thing as a patient or anyone in life, you don't want to feel like you're out of control. You're at the mercy of something that's just debilitating your life. the more we can get our mob onto this, the better they're going to be. And these numbers are going to, for life expectancy, will get bigger, and the other numbers that show that we are high, they'll just get minimized. And without going too much into this page, as all practitioners on this call or nurses, this is what you are all striving to do, is prevent hospital admissions. And unfortunately, for a lot of community members, especially remotely, like where I'm from, they think this is the only source of care they have to get, but they leave it to the last minute. So with this ITC program, like I keep saying, it's just that early intervention, the education around their chronic disease. And the more we can refer into that, the better we're going to, I guess, cut down these numbers here in the hospital admission. So how do you refer your patients into the ITC? Well, this is all done through a e-referral system called SENT. This is all partnered with HNE, and it runs inside with allied health and public health providers to provide a secure electronic system to send referrals. You can go to our website for more information about this. Health Pathways is probably a big one we use. But just note that the patient cannot get referred or cannot go into the ITC program without a GP referral. And usually you find, I guess when you're doing a 715 health check, then it just flows from there, from the 715 health check. All these forms too are available on the Health Pathways, the SENT system forms. And I'll give you more of that information later in this presentation. So who's your providers and how can they assist? So these are the ones that you see on the right of this screen right now. So that's New England Healthwise. And the Hunter, it's Inner Primary Care. Up in Taree, it's Biripi AMS. So AMS means Aboriginal Medical Service, if no one doesn't know. Central Coast is Yaren AMS. Up in Foster, it's Toowoomba, that's another AMS. In Singleton, it's Ungaroo, which is another AMS. So what they will help your patients with is the care coordinating service, the facilitating of the gap payments, the consultations, transport, assisting and providing medical aids, the health literacy, and supporting patients to achieve self-management of their own chronic health disease. Just simply now on this slide here, we're just going to show you the relationship between the GP and the care coordinator of the ITC program. And without me reading every dot point here that's on the screen, all it is the patient has been referred into the program from their GP that has diabetes and then asking the care coordinator for assistance. The patient does need urgent podiatry service, so the care coordinator will look at both avenues, looking in the public system, the private health system, and whatever's available. The care coordinator will book that appointment, and then obviously the care coordinator will then ask the patient, do you need transport? Yes, they do. So then they'll arrange that as well. So then there is no hiccups or no roadblocks for those appointments to be made. And so the patient gets the front foot, or get on the front foot with their health condition. And like I was mentioning before about the Health Pathways page with the referrals, this will be the page you go into when you click on Health Pathways. You can see there on the left with all the tabs on the side there. If you go down where it says under Public Health and the Pacific Populations, there's First Nations Health. Obviously, if you click on that, it'll bring up in the middle there, as it says First Nations Health and what's in this section. Just run through what's under there and what you can go into. Obviously, at the bottom of all the tabs there, you can see referrals for First Nations people. In there will be the breakdown of the whole electronic system for everyone. But if you ever get a chance to go in there and just, because it will go through the 715 there, closing the gap, proving health outcomes, cultural awareness. As you can see on the screen, it's all there. But yeah, so a lot of Bree, Foley, and Karen, you've seen a lot of these other presentations. They've done a lot of work for everyone that's in the practice there now, so user friendly. So when you go into this, it's actually quite easy to find instead of just fumbling away through. And because sometimes a lot of these pages, as you know, when you go in there, sometimes it takes you off in a lot of other directions. the girls have done really well to make sure that this is relevant, it's all up to date, and it's user friendly. And I'm not too sure if Karen's already mentioned this in probably previous slides. I think I have, but on our website, this is our website here. You can see myself and my family, but this is available and other resources for yourselves. And it's just, if you need something or you want something like resources or fact sheets or get in contact with community members or training videos or anything else to make your practice or your place of business culturally safe, we have that available on our website as well. So that's what it looks like when you go into it. Yeah, just go to the First Nations tab when you go through, and this will bring you to this page here where you can see, like I said, myself and my family, and then it just drops down, and then it'll just go from there. And like we've said in previous slides, if you be so kind to fill out one of these surveys, it just helps us with our delivering of these training videos. So that way we make sure that we deliver the best training for you guys and cover every aspect of what you need to know in each presentation. This will be greatly appreciated, good and bad. It doesn't matter. Feedback's feedback. It all helps with the improvement of how everything flows. So thank you. And that brings us to the end of our presentation for the Integrated Team Care Program. And I just want to say thank you for tuning in today from myself and Karen and the team. It means a lot. We do understand that time is an essence of working in a practice. Everything's go, go, go. But we do appreciate your time and hopefully got a lot out of it. It was a short one. And also, I'd just like to say thank you from myself. Thank you for seeing the mob in the communities that you work in or the areas that you work in. It means a lot helping our mob get on the right foot and get in the right healthcare. So we'll see you in the next presentation. Enjoy the rest of your day and catch you later. Yahweh.